everybody. Welcome back to another episode of Hybrid Healing Hour. Today, I'm super excited. It took me, almost a year or longer to finally get my colleagues in on this podcast. So I'm super excited. We're going to talk about our PAs in our office today. And I'm introducing Elizabeth Elam and Drew D'Angelo. Thank you for finally agreeing to come on.
Thank you for having us.
Yes. Or I kind of forced you a little bit, right, Drew?
Maybe a little.
Okay. So today I just wanted everybody to get to know us a little more. And I kind of want to address, what is a PA? So I'm going to go ahead and start a little bit of history with what a PA is. So we're talking about physician assistant. It is now called a physician associate. And we're going to kind of talk about that a little bit later. The first PA program actually began in 1965 at Duke University in North Carolina. And the concept of a PA originated actually in 1961 in an article by Charles Hudson, he's a doctor, in the Journal of American Medical Association. So the first program design of the PA school was actually by Dr. Eugene Stead, who was the chairman of the Department of Medicine at Duke, and he designed the program to address the shortage of primary care physicians in the United States. This was due to World War II. So the curriculum was based on the Stead's knowledge of the fast-track training of doctors during World War II. So we were basically we were mostly the medics, and we were the bridge, the gap between the injured military, victims on the field and the transportation to the doctors at the hospitals where they could be treated. And so we were able to, we were utilized in that instance to be able to stop the bleeding or keep somebody alive for that transportation or to address anything at the site of the injury. So the first PA class was made up of 4 former U.S. Navy hospital corpsmen and the U.S. Army combat medics. And that first graduating class was October 6th of 1967, which, for everybody out there, that is actually our anniversary day of what we now call PA Week. Anytime around October 6th, the week of October 6th is our week. And we're lucky, I think, because we actually get a whole week and we don't just get a day like doctors. So I want to go ahead and talk, this is showing the foundation of how we got into PA school, actually. I know it was very difficult. We had to have a background. This is started with, having experience, hands-on contact with patients and having so many hours of this contact with patients prior to even being able to get into PA school. So let's start with you, Lizzie. So why don't you go ahead and tell everybody a little bit about yourself and how you got to where you are today?
Sure. So I'm Lizzie, and I'm from Buffalo, New York. Go Bills, for any Bills fans out there. There's a lot of reasons I would say that I chose the PA route and why I got into medicine. So I'll start with why medicine in general, right? So I'm one of 5 kids and 2 parents. So out of the 7 of us, only 2 of us have not had cancer. I've seen lots of people in my family be touched by medicine, be healed by medicine, and it was really impactful throughout my entire life. And I really wanted to serve people the way my family was served. We're very blessed to have most people do quite well, and I wanted to be able to do that for others. So that's the why for me. And then the why medicine. Now, why PA is actually a really interesting question because there's a lot of different things you can do in medicine, right? You can go into, being a paramedic, you can be a respiratory therapist, you can be a physical therapist, occupational therapist, you can be an MD, an NP. There's so many different options, but I really love the flexibility of the PA profession, right? You don't have to be pigeonholed into one specialty. Right? So you can start off in internal medicine and then move into urology or oncology or, any field, right? And I love that about the PA profession. And that was really one of the biggest reasons is I just wanted flexibility with my future and my future career. Now, I have fallen in love with internal medicine and will probably never do anything else. but, it still is a great springboard, if there was any other interest in the future. Because learning, I think, is also foundational to being a PA. Loving learning and growing in our medical knowledge is also part of my why. I love to keep learning. That brought me then to, my background experience. So I did my undergraduate degree at Wake Forest in North Carolina. And after that, I went to be a medical assistant in a pediatric office. And that was my patient care experience prior to PA school. And I went to PA school at Northwestern in Chicago and graduated in 2017 and then came straight here to Florida, where I actually started with a different practice for about a year and a half before coming to Hybrid Medical Solution and have loved it ever since.
But it was internal medicine as well, right?
It was, yeah. So I've only had internal medicine experience. Yeah.
Right? Drew, go ahead.
All right. I'm originally from Central Florida, and then I went my undergrad in Gainesville at the University of Florida, so go Gators, always a Gator. And then after I graduated from UF, I worked as a CNA or a PCA is what we called it at Shands.
And what is that? What's a CNA? Or a PCA?
It's kind of like an assistant for the nurse, certified nursing assistant. So you do have to be certified. You have to go through a course. You can't just, go straight out of school. But it's a quick program. And you help with bathing and getting vitals, kind of like a medical assistant would be in an office setting, but it's in the hospital. And I worked for my patient care hours on a med surge. So step down from an ICU on a cardiac unit. So a lot of after open heart surgeries, those types of patients. And I got most of my patient care hours there before going to PA school down in South Florida at Nova, Southeastern University. And my why is kind of similar to Lizzie's, where I knew I always wanted to help people. I didn't really know how. A lot of my friends went into the nursing side of things, and I actually, in my undergrad, started out in biomedical engineering and figured out that I loved the medical side of things, did not enjoy the engineering side of things, so that's kind of what pushed me to go the medical route instead. And I actually had a few health things going on when I was at UF in my undergrad, and I went to a bunch of different doctors. Nobody could kind of figure out what was going on. They kind of pushed me to the side, and I finally found a PA who really took her time with me, spent a lot of time with me, figured out what was going on, and then I was able to kind of feel better and finish out the rest of my undergrad healthy. And so that's kind of what drew me to the PA profession. But I also like the flexibility that comes with it. I like that you can bounce around between different specialties and not feel like you have to be stuck in one. But I do agree that internal medicine has kind of been my favorite. I actually went into PA school thinking I wanted to do pediatrics and totally changed. Went to adults instead. But it's been fun.
Yeah. And what we haven't said is, the PA route when we're, just like doctors, I think, and probably nurse practitioners, when we're in PA school, we do something called clinical rotations, where we are working in, 8 or more different specialties, and that's what helps us decide where we want to go, right? So you might go in with one idea and then come out totally changed. So I, myself, Deanna, I had, a similar route or experience as well. So I was initially interested in becoming a MD, going to med school. And then as I was going through undergrad at Elmhurst College, I kind of realized I was in a long-term relationship, and I was like, I don't know if I really want to spend this long going, through med school. I might not, that's another 4 years med school, then 2 years at least of residency, depending on what you want to do. And then, so I was like, I might want to have a child or get married and have a baby by then. And, how times have changed. Still, I am married, but no child yet. So, I decided that's when they introduced me to the PA field. I didn't know much about it. So they're like, go shadow. So luckily, I actually shadowed 2 PAs, one in gastroenterology and one in Department of Transportation, occupational health actually is what it was. And so she did a lot of DOT exams. Mm-hmm. And she also did a lot of occupational hazards. So if somebody got stuck with a needle at their job site or something like that. So I realized I didn't want to do that, but I liked what they were able to do. I realized that a PA was able to do almost everything a doctor did. So I was like, well, why wouldn't I go this shorter, more expressed route, So I decided to go and pursue the PA route, which was hard for my father to even understand at that time because my mom was a nurse. And after I graduated from a 4-year private college, he was like, what do you mean you can't work? And I was like, well, I have a biology degree. And he's like, what do you do? I was like, well, I'm waiting to get into grad school now, So that was difficult. But in the meantime, what I did is I was already a pharmacy technician. So I think that helped me knowing medications really well. And then, however, PA school actually didn't count that as hours because I wasn't touching people. So I had to get a contact profession. So I actually became a phlebotomist and I did that. And then through that, I worked at a hospital where I actually got to meet several PAs and I worked with them closely and they did the ICU. They were in the intensive care unit and they were doing PICC lines or difficult draws. So if there was somebody I really couldn't get, I would work side by side with them on how to get that blood and figure out. And so that was actually something I was really interested in. I thought I would go to PA school, graduate, go back to Illinois, work at the hospital I was doing my phlebotomy in, and that would be my life. But once again, things changed while I was in PA school. So I went to South University. It was in Tampa, Florida, and I did my program there. And every program is slightly different. So mine was 28 months or 27 months. I don't remember anymore. It's been a while.
Mine was 27.
Yeah. And so we did 12 months of curriculum, which is book work and learning every day. There were 12-hour days sometimes and you had lab and
5.
everything. Yep. And so then that was intense. They say it's like drinking out of a fire hose with all the level of education you have to take in. And then we go into the rotations. And that's when I actually got to help deliver babies, and that was life-changing to me, and I really would have loved that. But I found that's where a lot of nurse practitioner midwives end up going there, and they've got one up on me, I guess, on that side. So then my next one, I fell in love with internal medicine so much that I actually did my elective. Yeah, I did my elective rotation in internal medicine, so because I just loved it so much. So that's what brought me here today. Yeah. So why don't you, Lizzie, tell our audience a little bit about your schooling was somewhat different.
Yeah, so my program was a 24-month program. And I, shameless plug for Northwestern University because I really love the way that they educate their PAs, both clinically and didactically. So the didactic year, when you're doing your book learning, they have an approach, 2 different approaches. First being a systems-based approach. What that means is when you are learning medicine, you can learn the different aspects individually. And by aspects, I mean the medicine, like the pharmacology, how medicines work, the anatomy, how to examine a patient, how to diagnose a patient. You can learn each one of those individually as a whole. Or the systems-based approach is you learn all of those different aspects for one system. So when you're learning about the heart and doing cardiology, you're doing the cadaver lab anatomy for the heart. You're learning all the heart-related medicines. You're learning all the heart diagnoses. And I found that to be really helpful because it allowed you to learn better and be able to apply, what you're learning in one class to another. So everything, built off each other. The other aspect of their didactic year training was something called PBL, or problem-based learning, where at the beginning of the week, you would have a patient case. And with that patient case, you would then go through all those different steps of how to diagnose that patient, taking a history, understanding what the patient is explaining regarding their symptoms. And based off of those symptoms, what types of tests do you need, right? Do you need a blood work? Do you need imaging? And everyone would go home and have different topics to learn. And so you would actually learn your topic and then teach your classmates at the next class 2 days later. And then the same thing would happen that time. Now you would then move from how you're diagnosing someone to then how you would treat them. And everyone, once again, would go home, do their learning, and then teach one another. Because I do think in medicine, you hear that phrase quite a bit. See one, do one, teach one, right? And when you have to teach someone, you learn it so much better.
I agree.
And I think we probably even feel that way when we're educating patients today is, we are repeatedly explaining, how to care for a condition, and it gets, re-ingrained in us all day, every day, and when we're learning, it's really helpful to be teaching and teaching each other too. I can't tell you how many times I ask questions to both of you and you guys teach me something new. And it's helpful, and I remember it. And then when I teach it to a student, because I precept students, it also then helps get re-ingrained. So, and then my clinical year, because we have 8 core rotations, but I actually got to have 4 electives, which I think was more than most programs.
Yeah.
And so I did an elective in dermatology, infectious disease, and pediatric hematology oncology, and adult hematology oncology.
Wow.
Yeah.
Yeah.
A lot of fun.
I only got 2, unfortunately. I
I
would have
have
loved
summer.
I'm right in the middle. I got 3. But like I said, I did all mine in pediatrics because that's where I thought I was going to go.
Right.
So
Well, and then we grabbed you right out of school.
right out of school, 2 months out.
And so that's one of the things I actually love about PAs is I feel like we can it is interesting. I preferred to hire Drew as a new grad, actually, because one, I feel like the knowledge is so fresh right there, right? And, as you practice and you see a lot of the same things, if you don't use it, you lose it a little bit. And another thing I like about PA is we have to recertify the most, I think, compared to nurse practitioners and physicians, whether it's MD, DO, we have to get 100 credit units or credit for educational credit, every 2 years. And we have to recertify, which they just changed recently to every 10 years, which is a big exam that we have to take every 10 years.
Or they have the longitudinal program, which is what I'm doing right now.
Okay.
So it's where every quarter of the year you do 25 questions. So that's what I'm working through.
I did the pilot for that.
I know you did, yeah.
So I'll be doing that then in 10 more years now. I just, yay, I just passed. So I do like that I do honestly, going back to the learning, like you said, Lizzie, is constantly learning. And, with us, and I think, to each their own also, that you can choose to not do any learning, really. You can choose to not go to any conferences, but we all continue, like we participate in grand rounds from Boca Regional Hospital every Tuesday. We're constantly listening to podcasts. We are constantly, reading and educating ourselves because we want to be the best provider we can be for our patients.
And that's part of the reason I actually take students too, because, and a good example of this was actually back in the spring. I had a patient with pneumonia and I looked at my student and I said, well, how do you treat pneumonia? And their response, I said, that's not the way I was taught. And before even saying that they were wrong, I said, let's look it up together. And sure enough, 2 months, 3 months beforehand, the guidelines had changed.
Wow.
Right? So the students are always learning what is most current and up to date, and they're helping me continue in my education. Of course, my role is to help train them as well, but I also find that they help keep me up to date. And I find that very, very helpful.
Absolutely. I agree. I love that. And so I did want to talk about our name actually recently changed. When was that, Drew?
I believe they said May of 2021.
Okay.
They finalized it.
Because I still use physician assistant.
I do too.
I actually just say PA.
Right. I was going to say, I just say PA.
So, but it's actually now physician associate. I think they're used interchangeably, but actually physician associate was changed. And at first I didn't like it, but I've come around to the term of it because it was actually the name of the first PA class in 1965. So I thought that was kind of cool how they brought history back. Yep. And the reason I am okay with it is because so many times when I was first in school or, when I first graduated, and I must look a little older now maybe because people used to say, oh my gosh, you're so young to practice. I'm sure you get that now, Drew. I'm the old lady.
All the time.
So they were like, oh, when are you going on to med school? I'm like, nope, this is it. Right. That was and I would always have to educate what am I and what I do. And that's what I want to kind of briefly talk about today. So why don't you tell our listeners what PAs can or cannot do?
Yeah, I mean, I feel like we have the ability to do just about everything a doctor can do, a nurse practitioner. I can't really think of very many limitations besides in like maybe the surgical realm. I know they can't necessarily be the surgeon. They have to be the first assist. They can't make that first cut. But they can, if the surgeon's okay with it, totally take over after that. But at least like in our office, I feel like we do everything that, Dr. Marias does. He sees his own patients. We see our own patients. We're their primary care provider. We kind of take over their total care. I don't feel like we're limited in that sense at all.
I agree. And I didn't know if you had anything to add to that, Lizzie.
Yeah, I mean, as far as what we can do, just to kind of spell it out a bit, we evaluate a patient through history and physical exam, and we can order the appropriate imaging tests and laboratory tests and interpret those results. We can prescribe medications. One thing that we cannot do with regarding to prescription medications is, in this is more related probably to a state legislation or rule, is that we cannot prescribe Schedule II medications for more than 1 week at a time.
Right. And examples of that would be like attention deficit medications like Adderall or
exactly, or pain medications, so we don't do any chronic pain management. At least we don't in our office. I'm not sure if PAs in Florida, have a role in those practices, just because we can't do the prescribing for chronic pain medication. And so that's really, exactly what our clinical role, I feel like, is day-to-day.
You are correct. It is state dependent. And Florida actually seems to be one of the more strict states for PAs. We are able to own a practice in the state of Florida, but we still need to have a collaborating physician. And as we say collaborating, we used to say supervising physician, but that made it sound like we weren't able to do anything on our own. So we, as we like to say, is collaborating, right? And so we can own a clinic, actually, and we can have our own providers, but we do have to have that collaborating physician for that reference in case there's something we can't do, aren't comfortable doing. And I'd say, I think between the three of us, we're really good at staying within our scope of medicine. And that's where you need to, just find the correct provider. I know there are people out there, there's nurse practitioners and PAs out there that I've seen go probably beyond the scope of what I would feel comfortable with. But if they worked in rural Montana and they were the only provider within 100 miles, they were doing probably a lot of things that I wouldn't do these days, So everybody has their own experience and everybody has their own history. So it's something that you just need to find. And I used to brag about how, we could just take a little more time with our patients and how I feel like we are a little more sincere or empathetic. But, working with Dr. Myers, he's not so bad after all. So
he's one of a kind.
Yes.
They're not all like that.
Right. And one thing I wanted to say is, don't get confused. A PA, physician assistant or physician associate, we are not assistants to the physician. So I want to correct that. It is not physician's assistant. It is physician, no S at the end of that. That's one of my pet peeves. So now you all know, and you can say it correctly. And, we're not power of attorney or personal assistant and whatnot. Now, there's also another field out there that I have recently learned about. I don't know when they came out, but it's actually called associate physician. So it's complete opposite. Or reversal, right? Backwards. This is actually somebody who passed med school, the 4 years of med school, but for some reason they weren't able to get matched with residency. And so you may see this profession out there as well. And, they're working like PAs, from my knowledge. And I think, once again, that is state dependent as well. There's only a few states out there, from my knowledge, that have that option. But I feel like we've cleared everything. I mean, once again, everything is state dependent. Florida seems to be more of the strict states, and we're constantly pushing to get autonomy. But I think we're very fortunate that I feel like we have autonomy within our practice, and I feel like we're all pretty confident in what we do.
Absolutely.
And I know, like, there's, we can do procedures. We can do in our office, like the pellets, right? Drew and I choose. Lizzie just chooses not to. She could do it, but we choose to do the, pellet hormone replacement therapy. I do joint injections in the shoulder or the knee. I'm not comfortable in our office doing them anywhere else, but that's where I choose to. I can do, cortisone injections with epicondylitis, at the elbow. So you can easily, as a PA, go on to train further. You can do classes. I constantly get emails about learning manipulation techniques, which I would love to do that at some point. So I have a big laundry list of continuing education that I want to do. I constantly want to strive to learn more and do more.
PA residencies,
yes,
as
there
well.
is.
And I think some specialties, do prefer that, or
I think psychiatry. So I had a girl in my PA class actually did a psychiatry residency right out of PA school, and then she went on to work in psychiatry.
Right. I know, like, emergency medicine has a bunch.
Surgical.
Right.
Surgical, yeah.
Mm-hmm. And so, for any people out there who are thinking about the PA profession and PA route, that would be something to consider based off of, what type of field you'd like to go into.
Right.
But it's not necessary. There are plenty of people who graduate from school and go straight into, a surgical option. I'm sure that's what Rob did.
Yeah.
Right?
Yeah.
So...
and I know, like, we still do well woman exams in our office. I mean, we really can do everything. I love
to do a little bit of everything.
Yes, and I think that's one of the reasons why I'm so passionate about internal medicine as well and primary care, because we get to talk about everything, and there's not a dull day in our lives, right?
No.
Never.
Yeah, no.
And every day is different.
Absolutely.
You can have two different patients present with the same symptoms, but they're completely different people. It's unique, and that's why medicine is interesting and fascinating. Is each person is unique, and it's special that we get to care for them.
And I wanted to actually touch on that too, in the sense of, you mentioned the flexibility of a PA. Mm-hmm. That was actually my number one reason of choosing PA, because I had a fear. I didn't mention this, but I initially I wanted to go on to be a pharmacist. I was working for 15 years as a pharmacy technician at Walgreens, and I was like, I love medicine. I love learning meds and helping people. They had questions about medications and side effects, and they'd come in with their cough or cold. I'd be able to direct them where to go and get something. So I loved it, very, even though it wasn't touching them, I was very much in communication with the patient. And then I worked with a pharmacist who told me robots are replacing me. And I was like, oh my gosh, I'm fearful. And, and then he's like, well, you're too much of a people person to stand behind a counter. So I decided, that's when I pursued the PA route as well, or MDDO, right? And I was torn between the two. But I liked that PAs are certified in every field. Right. And so, like you said, Lizzie, we could do GI, gastroenterology. We could go into pediatrics. We could go into podiatry. We could do anything. And that flexibility. I knew I had a career of choice for the rest of my life. That if I did have a path that I did not like, say I did go to peds and I was like, oh no, this is not working out, I could switch that up and go to cardiology. I could do surgery. I could, anything. And we can still go and we could do wilderness medicine. You can do combat medicine, you could go into the military, it's just it's endless, that option. So yeah.
And I think with that too, one of the other things, when you think about the medical route, medical school is a huge both time commitment, like you mentioned, when you're thinking about having a family, but then it's also a financial commitment as well, right? And so that's another, I feel like, piece of the puzzle. for people considering the PA profession is that the shortened time, one of my thoughts was always, well, I'm not going to have kids or think about really planning a family until I have my education paid off, right? And so then that delays to some extent your family planning. And with the flexibility as well, when you come out and you are an MD or a DO and you've invested all of this time and all of this money into your career, how do you say, well, now I'm just going to work part-time as a mom and still be paying off my loans? These were a lot of the thoughts I was having prior to going to PA school, because I knew first and foremost I wanted a family. And that for me was a really big goal. And what I have loved about my practice here at our office is, I've really reduced my hours so that I can, be a PA in the morning and serve my patients well, and then be a mom in the afternoon. I can pick up my kids from school. I can get them to their appointments. I can be there for them fully. And that to me is really great. And I have no qualms in the back of my head about, well, by reducing my patient load and reducing, my salary or what have you, I'm not making ends meet like I need to, because I have all this financial debt.
Right. Exactly. Well, sure. And let me ask you guys, did either of you work when you were in PA school?
No,
I did not.
I know a lot of times they tell you not to, and that's one thing that I sure did.
So
I didn't work a lot, but I worked like 4 to 8 hours, a week, probably. Like I was lucky, like at Walgreens as a pharmacy tech, they had the 4 to 9 p.m. shift. So I would go to school, and on the days that I didn't have a lab after, like if we were done, and I'd go to work, and then I'd just come back and study after, and it all worked out. But it gave me some extra cash, and it was quite nice, And that's the thing that's different, I think, with nursing, nurse practitioners, right? They have more the nursing route. They were a nurse prior, and they continued to work as a nurse during nurse practitioner school. Yeah. So, I actually think that's not a bad thing or a good thing, right? In a sense, I think by going the medical route, like PAs are more following the medical route that MDs and DOs do, that we are able to separate the professions that we have. Like we're able to learn how to evaluate, like you said, Lizzie, earlier, taking the whole patient history, evaluating and diagnosing and knowing the actual pharmacology behind the reason why we're prescribing something and what disease process we're prescribing it for, versus sometimes I think if you're still working in a field that you were previously, it's hard to get out of that mindset of, oh, let me just put the order in that I was told to do or something like that, So sometimes that's different care. But I will say nurse practitioners are great and nurses are great because they definitely have the empathy that I may not quite have. But I'm brutally honest, and everybody knows, that's how I am.
I think it's the analytical thought process, right?
Yeah.
I think that for, any student, no matter what stage you're in, asking that question why is always important. Mm-hmm. And I think that's what's championed in at least my program, is to be analytical and to ask questions that are thought-provoking and be able to educate yourself to find the right answer, right? You might not need to know the answer right away, but have the resources and tools to learn and teach yourself to be able to come to the appropriate conclusion. And I really do think that that's something that I loved about, my training and my education is, to always be analytical. And that's to some extent, I think, mirrors the medical doctor or the DO route.
Mm-hmm. Absolutely.
Yeah. And I have to say, at least for my program, I started in 2020, which is right when COVID was happening.
Oh, Lord.
PA programs were not necessarily equipped for online learning. And I do have to say that Nova definitely stepped up, because everybody was at home, essentially teaching themselves, having to really be organized and make sure that you were, watching the lectures when you were supposed to, doing, all of your assignments and things like that. So I almost feel like now after PA school, I'm better at keeping up up to date with things because I kind of already had to do that because I wasn't in a classroom setting in PA school. So
yeah, it's just another learning technique, right?
Yeah, very different, but still works.
Well, I hope this was educational for all of our listeners out there to learn a little bit about us and a little bit about the PA field. Thank you, Lizzie and Drew, for coming on.
Thanks for having us.
I hope you come back someday.
Thank you. This wasn't so bad.
Right. So long.
The information contained in this podcast is provided for informational and educational purposes only and is not intended for the purposes of diagnosing, curing, treating, or preventing any disease. This podcast is provided on the understanding that it does not constitute medical or other professional advice or services. Before using any products or services referenced on this podcast, consult with your healthcare provider, carefully read all labels, and heed all directions and cautions that accompany the products. Information found or received through the podcast should not be used in place of a consultation or advice from a healthcare provider. If you suspect you have a medical problem or should you have any healthcare questions, please promptly call or see your healthcare provider. This podcast, including Dr. Brian Marias, Deanna Weilbacher, and Hybrid Medical Solution, do not claim responsibility for any adverse effects from the use of information contained herein. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for any statements made by the guests. This podcast does not make any representations or warranties about guest qualifications or credibility. This podcast may contain paid endorsements and advertisements for products or services. Individuals on this podcast may have a direct or indirect financial interest in products or services referenced.
If you would like to submit any questions or if you have any topics you would be interested in hearing about on future episodes, please contact us through our website, www.hybridmedicalsolution.com. That is solution with no S at the end. Follow us on Instagram and Facebook, all under Hybrid Medical Solution.